These are the discharge instructions. Both pages need a sticker. The law enforcement agency needs to be spelled out just to make it easier on the patient. If it's a reported case, put the appropriate law enforcement agency. If it's a non-report, put Texas Department of Public Safety. The case number is either the law enforcement case number or the SPFN number. The track it sticker that comes inside the box goes underneath in that little space. Check the appropriate box for the medications you gave or sent home with the patient. It's very rare to call in a prescription, but it does happen every once in a while. Anything on these pages in bold is an important reminder for the patient, so just make sure to tell them. Check the appropriate box for the pregnancy test, and then check the appropriate boxes for follow-up testing that's needed. The instructions under each follow-up testing are really good and really clear. And then just remind the patient that once they receive follow-up care that they should follow the recommendations of their provider. This is the second page of the discharge instructions. It needs a sticker as well. If you made a Planned Parenthood appointment, check the appropriate location and add the date and time underneath. Check the other box if they are seeing their own provider, going to the Kind Clinic, or if they're going to call us when they're ready for us to make an appointment for them. Check the referral box if we are going to call them to make the appointment. Additional information is used for any important information that needs to be remembered or any recommendations that you made. The patient can use the hotline number for any needs or recommendations or any immediate needs. They can reach out to advocates and nurses separately for non-urgent needs, either by email or phone number. The numbers provided for victim services are for Austin Police Department and Travis County Sheriff's Office only. Any other jurisdictions will need to be looked up if the patient doesn't already have that contact information. And then always remind the patient that we do not see the results and that they need to contact law enforcement for follow-up on their cases. And then the patient prints and signs their name. The date of discharge, it may be different than the official date of service if the exam goes past midnight. And if indicated by age or disability, the parent or guardian prints and signs on the second line. Make sure to check the box of the person signing, either the patient, parent, or guardian. Then the nurse prints signs and then dates on the bottom line.